Shida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today my mentees are going to discuss about a neurological condition called the thalamic stroke, which is an interesting condition in which the thalamic stroke patients will depict the different symptoms which is different from other type of strokes like MCA stroke, ACA stroke and PCA stroke. So let us discuss about it in detail. So let's begin with the introduction. What is thalamic stroke and which anatomically which location will be affected in that?
Good morning everyone. Today our group is discussing about the thalamic stroke, a type of stroke affecting the thalamus. The thalamus is a pad structure located deep within the brain, forming part of diencephalon. It acts as a relay center, transmitting sensory and motor signal to the cerebral cortex. Almost all the sensory pathways except alpha 3 pass through the thalamus. It also plays a crucial role conscious sleep-wake cycle motor integration. A stroke in this region can therefore produce compulsory sensory, motor and cognitive symptoms depending on the nuclei involved.
Yes, she told about the thalamic stroke introduction and what can be the causes and risk factors for the thalamic stroke?
The thalamic stroke usually occurs due to infection of blood supply to the thalamus, primarily involving branches of posterior cerebral artery. There are two main types which are ischemic stroke and hemorrhagic stroke. The key factors include hypertension, which is most significant, diabetes mellitus, hyperlipidemia, smoking and cardiac condition called atrial fibrillation. Unique vascular variant called arteria pectorum can supply both sides of thalamus and its occurrence can cause bilateral thalamic infarct, which are rare but severe.
Yeah. What can be the clinical features of it?
Thalamic stroke can be presented with diverse symptoms of RS, which is due to a complex function. So the common clinical features includes the contralateral sensory losses like pain, temperature and touch, and the thalamic pains include motor weakness and coordinatory problems. The patient may also present with the altered consciousness and very impairment and emotional disturbances.
Yes, along with the motor impairment, there will be some emotional disturbances, memory and intellectual disturbances will also be there in the thalamic stroke cases. So, how will you diagnose whether it is thalamic stroke or other type of stroke?
For the diagnostic for the thalamic stroke, through clinical evaluation and imaging. Imaging we can evaluate by CT scan and MRI. MRI scan for most sensitive for early diagnosis and management like ischemic thrombotic for thrombolysis and anti-platelet therapy, and also control the hypertension. Pain management for thalamic pain syndrome, including like anticonvulsants.
Yes, we have to manage the pain and also we have to give the anticonvulsants and also we have to treat it symptomatically. So what are the clinical features she mentioned? We have to address the motor problem and also some intellectual disturbances will be there. We have to cope up with that also. So how will you manage the thalamic stroke case?
Physiotherapy plays a vital role in constantly recovery after thalamic stroke. Key goals include improving sensory awareness, enhancing motor control, preventing complications. Interventions are sensory re-education technique, balance and coordination training, task-specific function training, pain management strategies. Patient education and family involvement are equally important. To conclude, thalamic stroke, though less common, has significant impact due to its role in sensory and motor integration. Early diagnosis, medical care, and rehabilitation are necessary for recovery.
Yeah, good. So as you are all in final year, so you know what is motor control and the motor control theories, right? So we have many of the theories in our motor control theory. So in that they will be focusing on neuroplasticity and motor relearning. Once we achieve motor control only, we can go to the next step called motor learning and motor relearning. So for all the neurological conditions, not only for the thalamic stroke, we have to focus on treating the motor control basis. We have to make sure the neuroplasticity occurs and we have to be concentrated on improving the motor control of the patient. Then we can enhance the motor relearning pattern in the patient. So as he said simply that motor control relearning strategy should be done for the thalamic stroke cases, and also we have to treat each and every segment of the body symptomatically. If there is a spasticity, you have to address individual spasticity. So that can be done with the help of any of the approaches like you may study about the OBAT, Brainstorm, Roots approach, PNF. So any technique or any of the program which is useful to the patient, you have to choose it accordingly apply it to the patient and see to that whether the patient is responding to that in a good way. If the patient is responding to that in a better way, you can continue that approach until you get a good result. So in thalamic stroke cases, you have to approach both symptomatically and also you have to treat the intellectual behavior disturbances like memory disturbance, or if the patient cannot able to orient, you have to cope up with that also. You should not be like the patient is not cooperating so that I will be treating that case. So mindset should be like whatever the patient is, we have to cope up with that and we have to give some kind of independence we need to give the patient to achieve. Then only we can be able to get a good result. Once you started achieving a better outcome, then the patient can directly become independent for the functional activities. So in assessment, we can use the stroke assessment scale in case if there is a spasticity assessment scale. Finally, the functional independence measure scale can also be used to measure those kind of independence in day-to-day activities. So always make sure that have the assessment sheet with you while you are performing the physiotherapy or while you are doing some assessment with the patient. So mark the progression weekly and make sure the progression happens in the group. So hope you all get to know about some